Emergencies can happen anytime, anywhere, and knowing how to respond could be the difference between life and death. Every year, hundreds of thousands of cardiac arrests occur outside hospitals, leaving victims with only minutes to survive. But with quick action, anyone can be a hero. Let's dive into CPR, a powerful, life-saving technique that can dramatically increase survival chances. What is CPR? CPR, cardiopulmonary resuscitation, is a technique that combines chest compressions with rescue breaths, restoring blood circulation when the heart has stopped. Whether it's a sudden cardiac arrest, drowning, or choking, CPR keeps oxygen flowing to the brain and heart until professional medical help arrives. Why is CPR important? Every second counts. The human brain begins to suffer damage after just 4 minutes without oxygen, and death can occur within 10 minutes. Immediate CPR provides crucial time until emergency responders arrive. Before you begin CPR, 1. Assess the scene. Make sure it's safe to approach. 2. Check responsiveness. Gently shake the person and ask, "Are you okay?" 3. Call emergency services or have someone call for help. 4. Look, listen, and feel for normal breathing. If the person is unresponsive and not breathing, it's time to act. Performing CPR, step by step. For adults, place the person flat on their back. Start chest compressions. Push hard and fast in the center of the chest, at least 2 inches deep, at a rate of 100 to 120 compressions per minute. If trained, give rescue breaths. Tilt the head back, lift the chin, pinch the nose shut, and give 2 breaths. Continue cycles of 30 compressions and 2 breaths until help arrives. For children, ages 1 to 8. Use 1 or 2 hands, compressing the chest about 2 inches deep. Maintain 30 compressions to 2 breaths if alone, or 15 compressions to 2 breaths with a second rescuer. Use pediatric AED pads if available. For infants under 1 year, use 2 fingers just below the nipple line, compressing about 1.5 inches deep. Give gentle puffs of air for rescue breaths, covering both the nose and mouth. Maintain 30 compressions to 2 breaths for 1 rescuer, or 15 compressions to 2 breaths for 2 rescuers. Using an automated external defibrillator, AED ***. Turn on the AED and follow the voice instructions. Place the pads correctly on the person's chest. Ensure no one is touching the body during analysis or shock. Resume CPR immediately if advised. Hands-only CPR. If you're untrained or uncomfortable giving breaths, perform hands-only CPR. 1. Call emergency services. 2. Push hard and fast in the center of the chest at 100 to 120 compressions per minute. 3. Continue until medical professionals arrive. Tips for effective CPR. Minimize interruptions. Keep compressions steady. Push deep and at the correct pace for maximum impact. Stay calm. Focus on the task and keep going. Get CPR training. Hands-on practice builds confidence. Common mistakes to avoid. Not pushing deep enough or too slowly. Leaning on the chest between compressions. Full recoil is essential. Stopping compressions for too long. Incorrect hand placement reducing effectiveness. When to stop CPR. The person starts breathing normally. Emergency responders take over. An AED advises stopping. You are physically exhausted. The scene becomes unsafe. CPR isn't just for medical professionals. It's a skill that empowers you to save lives. Whether you're a parent, teacher, coach, or just someone who wants to be prepared, learning CPR is a simple but powerful way to make a difference. Get trained today and help keep your community safe, 1 heartbeat at a time. Note: this guide is for informational purposes and not a substitute for professional training. Always follow local guidelines and protocols when performing CPR. Like and subscribe.